Good morning, everybody. Today I will deal with the remaining portion of my previous day's lecture on nerve fibers. Now, classification of nerve fibers. It was observed that in myelinated nerve fiber, velocity of conduction is in meter per second is roughly 6 times the diameter in microns. Thus, a nerve fiber with a diameter of 12 mu has a conduction velocity roughly 72 meter per second. In contrast, in unmyelinated fiber, the velocity of conduction is roughly proportional to the square root of the diameter of the nerve fiber. These fibers can be divided into 3 broad groups such as A, B and C. Group A was further subclassified into alpha, beta, gamma and delta subgroups. This classification again is not complete, especially in case of sensory nerves. Therefore, a numerical classification was evolved to classify the sensory nerves. Roman numerals 1, 2, 3 and 4 were used in the classification. Apart from the differences in function seen in the different types of nerves fiber mentioned, there are important differences in their response to hypoxia, pressure and anesthetics. Thus, thicker the nerve, the more sensitive they are to pressure. On the other hand, as the diameter of nerve fiber increases, their sensitivity to anesthetics decreases. The intermediate diameter nerve fiber, in contrast, are more prone to hypoxic damage. Welcome and good morning, everybody. Injury to the nerve occurs following cutting or crushing injury or due to external pressure causing hypoxia of the nerve. Nerve injury has been classified into 5 types, degrees. First degree of injury, known as neuropraxia. This is caused by pressure on the nerve for a short period. This is the most common type of nerve injury. Due to pressure, the nerve suffers from hypoxia. As a result, there is reversible loss of function lasting from a few hours to a few weeks, depending on the severity. Saturday night palsy is an example of first degree nerve injury, in which there is irreversible paralysis of radial nerve in a drunk person. This occurs due to the persistent pressure on the nerve trunk, as the drunk patient sleeps with arm under his head. Second degree nerve injury. Here the injury in the nerve is due to a more severe degree of pressure leading to death of actions. However, the endoneural tube is not interrupted. In addition to death of action, at the site of injury, distal axon degenerates. This is accomplished by chromatolysis. Regeneration of the axon is helped by intact endoneural tube. This is followed by regeneration of myelin sheath, phrenic rash, an obsolete form of treatment of pulmonary tuberculosis. Third, fourth and fifth degree injuries. These are more severe types of injury. In the third degree injury, the endoneural tube are disrupted. In fourth degree injury, the nerve fascicles undergo structural disorganization. In the fifth degree injury, there is complete transaction of the nerve trunk. Now, changes in the fifth degree injury in the cell body. Degenerative changes. Nasal granules disintegrate within 48 hours and lose their staining properties. The Golgi apparatus degenerates and becomes fragmented. Neurofibrils are no longer visible. There is swelling of the cells which now become rounded in appearance. The nucleus may assume an eccentric position and even may disappear, which heralds the cell death. Changes during the regeneration. Recovery commences after 20 days and may take 80 days for completion. Nasal granules and the Golgi apparatus are restored. The nucleus regains its central position and swelling of the cell subsides. Now, what are the changes in the nerve fibers? Number one, degenerative changes. In the portion distal to the site of injury, there is Wallerian degeneration. The axis cylinder breaks down into short segments. The myelin sheath also breaks down and is replaced by lipid droplets. The axon is replaced by debris derived from the degenerative changes. The Schwann cell multiplies and the new cells come to occupy the endoneural tube. Macrophages phagocytose the myelin sheath and axis cylinder remnants and clear the debris. The empty space created in this way is occupied by the growing Schwann cells. In the proximal stump, the degenerative changes are similar but take place only up to the nearest node of Ranvier. Changes at the site of injury. Schwann cells give rise to elongated processes which project in various directions from the distal stump. Similar growth also occurs from proximal stump, but it is quantitatively much smaller. In this way, the gap between the severed portions is filled by the Schwann cells outgrowth. It is possible to bridge gaps up to 3 mm, and this is facilitated by surgical approximation of the cart ends. Now, changes during the regeneration. The axon is in the proximal stump grows, giving off a large number of fibrils, about 100 in numbers. These fibrils enter the distal endoneural tubes guided by the Schwann cell strands. Although the more than one fibril may enter the endoneural tube, ultimately only one of them survives and goes on growing to fill the tube. Myelin sheath regeneration begins 2 weeks and continues along the growth of fibrils. Myelin sheath regeneration takes place up to 1 year to be complete. Diameter of the regenerated nerve cells, nerve fibers, is always smaller compared to that of the original nerve fiber. The maximum diameter of the regenerated nerve fiber does not exceed the 80% of the original value. The process of regeneration of neuron is helped by growth-stimulating substances secreted from the Schwann cells, neurotrophins, and some specific cell adhesion molecules. Also, the perineum secretes the inhibitory substances to guide the sprouting actions in the correct path. The regenerating nerve fibers sometimes make the nerve fiber carrying temperature sensation may make connection with a touch receptor. Thus, touch sensation may be misinterpreted as temperature sensation. Unlike in peripheral nervous system, axonal regeneration cannot occur in the central nervous system, that is, in the brain and spinal cord. This is due to secretion of inhibitory substances by oligodendrocytes. It may be noteworthy that whereas Schwann cells help in axonal regeneration, oligodendrocytes, their counterparts in the CNS, prevent the regeneration of axons. Thank you. I come to the conclusion of my lesson today.